Hey guys, all right, gonna keep on rolling. I'm about to lose my voice today, I think so, but we're gonna go ahead and jump in and talk about the chapter dealing with asthma. So I'm gonna go ahead and share screen. All right, so exercise for those with asthma. We kind of all know a general idea of what asthma is. We're gonna talk a little bit more about that now. So basically what asthma is, it's characterized by the chronic inflammation of the airways. People generally have hyperactive bronchi that temporarily narrow the respiratory passageways. So if you narrow the passageways, you're not going to be able to breathe as effectively as if they're not narrowed and inflamed. Asthma attack is characterized by shortness of breath, tightness in the chest, coughing, and wheezing. These symptoms, they can vary from person to person. They can differ from even day to day in the same person. The symptoms can be mild, moderate, or even severe enough sometimes to cause death. So know that asthma is characterized by chronic inflammation of the airways and hyperactive bronchi. Know what the symptoms of an asthma attack are. They include shortness of breath, tightness of the chest, coughing, and wheezing. So 1 out of every 14 Americans is said to have asthma. This number includes 7 million children younger than the age of 18, with $10 billion spent annually on asthma-related healthcare costs. Since there's such a big prevalence of asthma, every American should be aware of the consequences, and fitness professionals in particular should be ready to work with asthmatic clients. People between the ages of 11 and 18 are affected the most by asthma. Just a fun little fact there. So, as far as normal respiratory system functioning, what are the components of the respiratory system? The nasal cavity, the pharynx, the trachea, bronchi, bronchioles, and the lungs. Those are the components of our respiratory system. Since inhaled oxygen needs to enter the blood to reach body cells, the lungs are richly supplied with blood vessels. There's lots of pulmonary capillaries surrounding each alveolus, and what they do is they facilitate the gas exchange between the two structures. It allows oxygen to move in the blood vessels while carbon dioxide moves into the alveoli. So that's kind of like the selective membranes that we've talked about before. This is where gas exchange takes place. Normal respiratory system functioning, some more. Air is going to enter the nose or mouth, enter the trachea. The trachea branches into right and left primary bronchi. These primary bronchi continue to branch repeatedly until they form terminal bronchioles, which end in air sacs that are called alveoli. The gas exchange occurs between alveoli of the lungs and pulmonary capillaries surrounding the alveoli. And there in the book are some good pictures of this and how it works. As far as the structure of our respiratory passageways, they consist of hollow tubes that are enclosed by walls made up of various types of tissue, including an inner mucous membrane lining, a cartilage layer that supports the airway and keeps it open, and a smooth muscle layer. And what the respiratory passageways do, these hollow tubes, they're responsible for filtering, warming, and for moistening our air. All of those things are things that need to happen, are important, and make breathing easier. So, heat radiating from the blood vessels deep inside the lining is going to warm up the air. This warming of the inspired or breathed in air is important because cold air can actually shock the respiratory system and constrict some of the bronchioles in the lungs. So remember that warm air is important. Cold air can cause a constriction. As far as the trachea, Your cartilage is going to prevent the collapse of the trachea during breathing. That's what keeps the form of your trachea, is cartilage. Respiration. It's defined as the overall exchange of oxygen for carbon dioxide. Oxygen is needed by cells so they can make ATP, or energy, the energy necessary for cellular functioning. And respiration consists of 4 things. You need to know these: ventilation, external respiration, internal respiration, and cellular respiration. There are different levels of respiration. Ventilation is simply the movement of air into and out of the lungs. It's going to include inhalation and exhalation. External respiration, that's where your blood vessels transport carbon dioxide to the lungs, where the carbon dioxide diffuses from the pulmonary blood vessels into the alveoli, while oxygen from the alveoli diffuses into the blood. Internal respiration, that is the process of moving carbon dioxide out of the cells and into the blood. Cellular respiration occurs at the cellular level, much as the name would lead you to believe. So know the difference on this slide of ventilation, external, internal, and cellular respiration. So there's some anatomical changes that happen with asthma. Asthma attack is going to occur when the lining of the respiratory passageways is inflamed, and that starts to interfere with your air movement. Your airways are going to be red and swollen. The airway lining may produce excess mucus, too much of that, and your smooth muscle layer will constrict, which is going to narrow your breathing tube, your trachea. Diffusion of gases, oxygen and carbon dioxide, they easily diffuse across permeable membranes of alveoli and blood vessels. The oxygen content in alveoli is always greater than the oxygen content in pulmonary capillaries. Now, what that does is it's kind of like osmosis. We've all heard about osmosis. That allows oxygen to consistently move into the capillaries, and as that's happening, carbon dioxide can move into the alveoli. Things move to areas of less obstruction. That's not the word I was looking for, but things that are less crowded will allow more things to enter. Allergens play a role in asthma. Allergen is a substance that elicits an immune response in susceptible individuals. It might be hay fever. It may be certain types of flowers. It could be a bee sting. It could be types of food. Lots of different allergens. Allergens and other environmental irritants result in inflammation and airway constriction. Healthy airways respond by dilating, which eases air movement. Asthmatic airways are going to remain constricted. Smaller. As far as causes of asthma, not really clearly understood. There seems to be a genetic and environmental component involved, but it's not, like I say, not clearly understood. The genetic component, if one parent has asthma, each child has a 33% chance of developing asthma. If both parents have asthma, each child has a 70% chance of developing asthma. So there's a very clear, obvious genetic component tied into asthma. As far as environment and the environmental component, some studies have shown a correlation between asthma and diets that are high in processed foods, that are low in fiber, fruits and vegetables. If you're low in those things and you're eating a lot of processed foods, asthma may be more prevalent. Some believe the risk of asthma increases with exposure to indoor allergens and dust mites, staying inside too much, watching TV, using the computer, basically life these days during the COVID era. Some associate the increased prevalence of asthma to be tied to increased number of low birth weight babies also, and the decreased number of breastfed infants. So there's a lot of thoughts out there as to what causes it. And as it says, some associate this. So it's not necessarily the gospel. Children who are not breastfed don't get the natural anti-inflammatories and antibodies that are found in breast milk that helps protect against asthma. That is factual, though. Some experts believe that the prevalence of asthma is increasing partly because children are not adequately exposed to pathogens, so their immune systems aren't sufficiently challenged. I think that's something that's been brought up about this whole Corona 2020. Are we killing our immune system by masking up, using hand sanitizer, washing our hands? We're not getting around anybody. We're not getting any germs. Are our immune systems just not being challenged when they finally cut us loose? Are we going to get sick from every speck of dirt that gets on us? Just a question. So how do we manage asthma? Some tips for decreasing the frequency. You want to avoid triggers like mold, pollen, animal dander, dust mites, air pollutants. Learn to breathe properly, breathing through the nose and not hyperventilating. Stay away from respiratory infections like colds, flu, sore throats. Those are the major contributors to asthma attacks in children. Stay away from medications that make asthma symptoms worse. There's certain blood pressure medications, glaucoma, migraine, and diabetes medications that actually worsen asthma symptoms in some people. Exercise appropriately, and we're going to talk about some suggestions shortly about that. Maintaining a healthy weight, because having excess weight stresses the cardiorespiratory system and makes breathing more difficult already. Eating a healthy diet, it's not really known whether diet can prevent or cure asthma. A healthy diet might decrease the severity of the symptoms. So if it could help, why not do it? All right, here are some triggers for asthma. We've gone through a lot of these already. Irritants in the air, allergies, animal dander again, cold or very dry air. Remember that is possible. Also, strenuous exercise can trigger an asthma attack. Respiratory infections, strong smells could even do it. Smoke, intense exercise, much like strenuous exercise. Emotional stress. You know how people can get upset and start to hyperventilate and things like that. That's could run right into an asthma attack. There's some different medications that are given for asthma sufferers. Bronchodilators, these are used immediately prior to or during an asthma attack. It's made to instantly relax the bronchial tubes and prevent constriction, or to alleviate constriction. So it helps these bronchial tubes and things to open up where you can get more air. It's not constricted like it was before. The effects of bronchodilators can be seen for up to 6 hours. There are long-acting bronchodilators which help control symptoms during the night or during a particularly high pollen season. They last a little longer. Another type of asthma medication are corticosteroids. They manage short-term airway constriction. So you start having a problem, take corticosteroids to reduce existing inflammation. It can help bring down inflammation, but it's not something you would take on a regular basis because it wouldn't prevent it from showing up to start with. Anti-inflammatories, these serve as long-term prevention of swelling and redness in the airways. So know the difference in these different asthma medications, how they work. Overall, people with mild asthma sometimes don't need anti-inflammatories. They can rely on bronchodilators during an acute or sudden asthma attack, or can take that prior to exercise. Those with moderate to severe asthma, though, usually require anti-inflammatories and bronchodilators to appropriately manage their symptoms and prevent acute attacks. So as far as our breathing, there are some major muscles that are involved with breathing. Inhalation is an active process, involves a number of muscles, primarily the diaphragm and the external intercostals. You need to know what muscles are involved with inhalation. Diaphragm, external intercostals. Your diaphragm contracts and flattens, which actually it pulls down, which is going to decrease pressure in the lungs by making the lungs kind of longer. That pressure gradient pulls air in. When this pulls down, air is going to pull in through your mouth or nose. External intercostals, they contract and elevate the ribs and sternum to decrease the pressure in the lungs as well. And it also works on that pressure gradient pulling air in. Exhalation, in opposite of inhalation, is a passive process. It occurs when the diaphragm and external intercostals relax. So your diaphragm relaxes, raises back up. That's going to increase the pressure in the lungs, and it's going to force air out. It's a passive process. Inhalation is active. Exhalation is passive. It requires the action of a number of other muscles when lung tissue is damaged, as in someone with emphysema. As far as precautions during exercise, oxygen demand and carbon dioxide removal, the need for those increase. Know that exercise places a greater demand on the already insufficient respiratory system of someone who's suffering from asthma. So they already have trouble with their respiratory system and breathing if you're dealing with asthma. You throw exercise on top of it and there's even a greater demand. Asthma sufferers have a high risk of exercise-induced asthma, and that's where we talked about the bronchodilators playing a role. And you can take that before exercise, and it cuts down on the chance of this exercise-induced asthma. Symptoms usually arise 5 to 10 minutes after the start of exercise. They generally gradually resolve for the duration of the activity, so they will get better. As far as reducing the risk of EIA, or exercise-induced asthma, you want to warm up before exercise and cool down after. That's kind of a duh statement. You want to participate in activities that require short bursts of energy. Avoid long duration runs. Breathe through the nose as much as possible, and use bronchodilators as needed and as prescribed. Some benefits of exercise, we always talk about these, and this is important, and these are some things that you can use to motivate your clients. You're going to have improved overall physical conditioning and functional capacity, decreased hospitalizations, improved psychological mood, and a decreased risk for chronic conditions. As far as exercise testing, administer tests in shorter increments with slower progression rates to avoid dyspnea, which is difficulty in breathing or shortness of breath. You want to terminate testing in cases of arterial oxygen desaturation. The preferred mode for exercise testing for people with asthma is just walking. Stationary cycling without the arm ergometry is also acceptable. You want to do a 6-minute walk test for those that have severe pulmonary disease. You can look up the 6-minute walk test. Some special concerns as far as guidelines for exercise for asthma sufferers. You want to include a longer warm-up before aerobic exercise and progress more slowly. You want to give their body time to adjust to what's going on. You want to perform a longer cool down after exercise. And remember that the mode of exercise is important. Exercise-induced asthma is more likely after certain forms of exercise. There's some activities that increase the likelihood of exercise-induced asthma. So we as practitioners, we don't want to be part of the problem. We don't want to be setting them up for exercise-induced asthma. They're there for us to help them. So any activity in a cold, dry climate, we talked about how cold air, dry air are not good for our breathing apparatus. Outdoor running carries an extreme risk. Outdoor cycling or soccer. Aerobic classes with excessive arm movements. The arm movements actually do play a role. And exercise intensities at or above 80 to 90% of maximal heart rate. Gosh, I don't have asthma, and that would probably give me a asthma attack right now if I did 90% of my max heart rate. As far as nutrition, there's some food and nutrients that might affect asthma symptoms. You've got antioxidants, folic acid, magnesium, omega-3. You notice how that shows up on almost everything. Water, calcium, salt, caffeine. Those are all things to be considered. Antioxidants, those are just nutrients that fight free radicals, inhibit the ability of free radicals to cause damage. Researchers are looking into caffeine's potential use as a treatment for asthma symptoms. So that is pretty cool because, number one, coffee's awesome. For an asthmatic, water intake is even more critical because water ensures a moist airway. We talked about how a moist airway is important, so water intake is key. And here's the summary for this chapter, and I'm going to cut off here. You need to come back and read this summary on your own. Thank you guys for hanging in there through another one. I think this is all I'm going to record today, but I'm going to go ahead and add this. Y'all hang in there. We're halfway home for this semester, and hope you're all doing well. See y'all soon.